Bulimia nervosa represents one of the most complex and misunderstood eating disorders affecting millions of individuals worldwide. Unlike other eating disorders that may be more visibly apparent, bulimia nervosa often remains hidden beneath a facade of normalcy, making it particularly dangerous and difficult to detect. This serious mental health condition is characterized by recurring episodes of binge eating followed by compensatory behaviors designed to prevent weight gain, creating a destructive cycle that can persist for years without proper intervention. The hallmark of bulimia nervosa lies in its cyclical nature, where individuals experience frequent episodes of consuming large quantities of food within short periods, accompanied by feelings of loss of control. These binge episodes are typically followed by various compensatory behaviors, most commonly self-induced vomiting, though some individuals may resort to laxative abuse, diuretic misuse, excessive exercise, or prolonged fasting. The secrecy surrounding these behaviors often allows bulimia nervosa to flourish undetected, as many sufferers maintain normal or near-normal body weights, making the disorder less obvious to family members, friends, and even healthcare professionals. Understanding the psychological landscape of bulimia nervosa reveals a complex interplay of factors that contribute to its development and maintenance. Many individuals with this disorder experience intense shame and guilt surrounding their eating behaviors, leading to social isolation and further psychological distress. The disorder often coexists with other mental health conditions, including depression, anxiety disorders, and substance abuse, creating a multifaceted challenge that requires comprehensive treatment approaches. Self-esteem issues frequently underlie the development of bulimia nervosa, with individuals often tying their self-worth to their body weight and shape, creating an unhealthy relationship with food and their physical appearance. The physical consequences of bulimia nervosa can be severe and potentially life-threatening, affecting virtually every system in the body. Frequent vomiting leads to dental erosion, as stomach acid repeatedly bathes the teeth, causing permanent damage to tooth enamel. Electrolyte imbalances resulting from purging behaviors can cause dangerous cardiac arrhythmias, muscle weakness, and kidney dysfunction. Chronic dehydration is common, along with swollen salivary glands that give the characteristic chipmunk cheeks appearance. Gastrointestinal complications include chronic constipation, particularly in those who abuse laxatives, and potential damage to the esophagus from repeated vomiting. The hands may develop calluses or scars from induced vomiting, known as Russell's sign, which can serve as a physical indicator of the disorder. Social and cultural factors play significant roles in the development of bulimia nervosa, particularly in societies that emphasize thinness and physical appearance. The constant bombardment of idealized body images through media, social networking platforms, and advertising creates unrealistic standards that many individuals struggle to achieve. Peer pressure, particularly during adolescence and young adulthood, can contribute to the onset of disordered eating behaviors. Family dynamics may also influence the development of bulimia nervosa, especially in households where there is excessive focus on weight, appearance, or food restriction. Additionally, certain professions or activities that emphasize body weight or appearance, such as modeling, dancing, or athletics, may increase the risk of developing this eating disorder. The demographic profile of bulimia nervosa shows that while it predominantly affects females, with approximately 90% of cases occurring in women, males are increasingly being diagnosed with this condition. The typical age of onset is during late adolescence or early adulthood, though the disorder can develop at any age. Unlike anorexia nervosa, individuals with bulimia nervosa often maintain normal body weights, making the disorder less apparent to others and potentially delaying diagnosis and treatment. This weight maintenance, combined with the secretive nature of the behaviors, allows many individuals to function normally in their daily lives while struggling internally with their eating disorder. Treatment approaches for bulimia nervosa have evolved significantly over the past decades, with evidence-based therapies showing promising results. Cognitive behavioral therapy has emerged as the gold standard treatment, focusing on identifying and modifying the thought patterns and behaviors that maintain the disorder. This therapeutic approach helps individuals recognize triggers for binge episodes, develop healthy coping strategies, and challenge distorted beliefs about food, weight, and body image. Dialectical behavior therapy has also shown effectiveness, particularly for individuals who struggle with emotional regulation and impulsive behaviors associated with bulimia nervosa. Nutritional rehabilitation forms a crucial component of bulimia nervosa treatment, requiring the expertise of registered dietitians who specialize in eating disorders. The goal is not simply weight restoration, as is often the case with anorexia nervosa, but rather the establishment of regular, balanced eating patterns that eliminate the binge-purge cycle. This process involves meal planning, nutritional education, and gradual exposure to feared foods in a controlled therapeutic environment. Many individuals with bulimia nervosa have lost touch with their natural hunger and satiety cues, making the relearning of normal eating patterns a challenging but essential part of recovery. Family involvement in treatment has proven beneficial, particularly for younger patients or those living with family members. Family-based therapy approaches help educate loved ones about the nature of bulimia nervosa, reducing blame and shame while creating a supportive environment for recovery. Support groups, both in person and online, provide valuable peer connections and shared experiences that can reduce feelings of isolation and shame commonly associated with this eating disorder. The recovery process from bulimia nervosa is often lengthy and may involve setbacks, requiring patience and persistence from both individuals and their treatment teams. Many people experience periods of improvement followed by relapse, which should be viewed as part of the recovery journey rather than failure. Long-term recovery typically involves ongoing therapy, nutritional counseling, and sometimes medication management to address co-occurring mental health conditions. Prevention efforts for bulimia nervosa focus on promoting body positivity, media literacy, and healthy relationships with food from an early age. Educational programs in schools and communities aim to increase awareness about eating disorders while promoting self-acceptance and resilience. Early intervention is crucial, as research indicates that individuals who receive treatment sooner after symptom onset generally have better outcomes. The prognosis for bulimia nervosa varies considerably among individuals, with factors such as duration of illness, severity of symptoms, presence of co-occurring conditions, and access to appropriate treatment all influencing outcomes. With proper treatment, many individuals can achieve full recovery and maintain healthy relationships with food and their bodies throughout their lives. However, some may continue to struggle with residual symptoms or may require ongoing support to maintain their recovery. Understanding bulimia nervosa requires recognizing it as a serious mental health condition that extends far beyond simple concerns about food or weight. It represents a complex interplay of biological, psychological, and social factors that require comprehensive, individualized treatment approaches. By increasing awareness, reducing stigma, and promoting access to effective treatment, society can better support those affected by this challenging disorder and work toward prevention in future generations.